So good morning guys, my name is Dr. Prince Rawat. I have cleared my FMG exam in my first attempt. I got 174 marks in January 2025. So the most common question which people used to ask me is how to read this book and whether you have to read it or you should not read it. So my first question for you will be is, have you ever read First Aid before? If the answer is yes, then you can definitely go with First Aid. But if the answer is no, then you should avoid First Aid, because the reason is, the number one is, First Aid is just a review book. It does not provide you any foundation, it does not provide you any concept, and in exam the concept will give you marks, not the facts. So what are the cons of this book? So the cons of this book is there is very less concept. You will not able to understand the concept behind a topic. There will be, most of the time will be facts which you have to mug up, and the things which you mug up you are tend to forget in your examination. So that's a con of this book. So for example, if I open a topic from, for example, biochemistry. So if I'll show you that biochemistry, it has some problem with it. Like I have to annotate it, and I was able to annotate it because I was reading this book since my internship. So I have read this book for like 1 year before my FMG exam. So for example, I show you this. Okay, if you can see it. So see, these are the annotation which I made. So the problem with this book is it has everything in a concise manner, but it does not have the clinical feature which are usually tested in any exam, whether it is FMG or it is NEETPG. So most of the time you have to annotate it. So right now the FMG exam for 2025 July is around 4 months. So if you have not read this book before, it is useless for you. The best thing for you is to go with your main notes or the notes of any platform which you follow. The another problem with this book is that it is factual based. Okay, so it is morely factual based, which you are going to mug up, and in the exam they are not going to ask you a one liner. So you need to make concept before going for this book. Now for whom this book is made. So if you are currently in your internship, or you are in third year, or you have at least 1 year for your FMG exam or NEETPG exam, this book is for you. You can go with the latest version, you can read it, and you can annotate this book only if you have conceptual knowledge. If you do not have any conceptual knowledge, then this book is waste for you. Do not go with it. It is just going to waste your time, and you are going to waste more time annotating this book. Now another thing is, if you are going with this book, the best thing about is that it has all the integrated systems. For example, if I'll show you, apart from the basic subject, it has all the integrated system of cardiovascular, endocrine, gastrointestinal, hematology and oncology, musculoskeletal, skin and connective tissue, neurology, psychiatry, etc. So this book is helpful if you want to integrate the subjects. For example, if you want to integrate the anatomy, physiology, pathology, microbiology, as well as the medicine part of it, then this book is very good. But if you want to go with the major subject, for example, if you want to read surgery, then this book is not for you, because there is like literally nothing about surgery. If you want to read about OB/GYN, there is like 30 to 40% regarding obstetrics. The another 70 to 80% you have to read it from any other source. So again, this book is not useful. And surgery and obstetrics, there are at least 60 questions asked, whether it is FMG or NEETPG. Regarding PSM is made basis on the US exam pattern. It is not made for FMG or NEETPG. So again, you have to annotate it. If I can show you, I will show you how I annotated the PSM part of it. So if I'll open about the PSM, it's 251 page. So see how much I had to annotate. The whole page I have annotated based on the pattern of our FMG examination. Another page, if I'll show you, see. So these things, it is not a part of this book. Regarding what will be the pattern of our exam, we have to annotate by its own. So again, I will tell you, if you have around 1 year of time. So you can go through this book, you can understand, you will learn how to integrate topics. But if you do not have any time, if you have just 4 months, then this is a waste of time. Do not go with this book. Don't be in a FOMO. You are going on a path of failure if you are going to read this book in the last 3 to 4 months. Make concise note of your main notes of any platform. That will be helpful for you. Now, one another question is, some people ask me, sir, I am not using any kind of platform, I am just trying to rely on the free source, so shall I use this book? So again, I will tell you, yes, you can rely on this book, but this does not guarantee your success. Even if you can read this book like 12 to 14 hours a day, still you are not guaranteed for success, because it does not have that FMG or NEETPG oriented concept in this book. One way or another, you have to annotate this book, because the topics are same, but the types of question which are asked is different. So this is my review regarding the USMLE, and I used to study from 2018, and currently the latest version is around 2024, and if I'm not wrong, they are going to release 2025 version within some months. So this is my review for USMLE. So be precise about from where you have to read. Don't go with the FOMO, like if my senior has read from this book, I should also read from this book. Again, I'll tell you, if you have a lot of time, then just go through this book, see if you can understand or not. And the last thing I will tell you is, if you want to read from this book, like if you have made up your mind, I want to read this from book, then I will suggest you read the microbiology and pathology. It has the best concept around. Like, I have seen so many YouTube videos, I have studied from Marrow or any other platform also, but microbiology and pathology, the concise note which they have given, it is best in this book. So I will recommend you to read microbiology and pathology in this book, and minor annotation is still needed in both these subjects. So yes, this is my review, and if you still have any question, you can text me in my Telegram. The link of my Telegram group is in the description. Subscribe to my channel. I am uploading all the high yield points and high yield facts about our FMG examination, so that you can pass your examination in your very first attempt, and that is my goal. So thank you very much.